Good afternoon. Hello and welcome to the Minnesota Department of Human Services Licensed Child Care Center Outreach Connection for December of 2024. I am Lisa Mills. I am a training specialist with the Child Care Center Licensing Unit. And I do remember a few years back, we had license holders asking for more opportunities to connect with our Child Care Center Licensing Unit. With that information, we heard you, and for that reason, we all have decided to create these outreach connection webinars. We find it as a way to reach all of our license holders most equitably. And we, along with various partners from throughout DHS and other agencies, have been coming together to offer these outreach connection webinars a couple times each year with the hope that more people will hear information directly from us and have opportunities to ask questions, provide feedback, and feel more connected as we all work together to make this the best date for children. We've asked several of our colleagues and partners to join us today as well as our licensing unit to share information that we feel and have heard from you, from many of you, is important to you. So as you can see here on this slide, we have numerous speakers, and we're going to do a little bit of housekeeping before we dive right in. So here we are today. This is our December Child Care Center Licensing Outreach Connection. We offered one back in June after the 2024 legislative session, and we like to wrap up the year kind of as a, like I said, a little wrap up and a highlight of what's coming ahead. And so you'll hear from many people today with just that, with information that we've talked about or has come out recently throughout the year, and then a little information about what's ahead. I again am Lisa Mills. I'm a training specialist and today's host from the Child Care Center Licensing Unit at Minnesota DHS. First, we would like to thank all of you for being here today and for the work that you do. Many of us here today have worked in several of your shoes. I know I have. I've been in this industry for decades. And so I recall how, when I heard DHS had information to share back in the day, I would have loved to have had an opportunity to hear it directly from them. In addition, this information is also information that we provide through our Gov deliveries, as well as oftentimes, we post information on our webpage. So we just want to welcome you, say we're here to connect and share a lot of information with you today through this outreach connection. There's a handout. We've created an accessible handout with links to all of the information that we're providing today. And so you can find that. It's been posted to our Child Care Center licensing webpage. I've also got the link here spelled out on this slide. And my colleague and fellow training specialist, Rena Henjum, has placed it in the chat for all of you. So you should have access to that handout. And we hope that that will be kind of a guide for you when the webinar is finished, so that you can go back and seek more information or know ways to contact the various speakers when this is all completed. So our agenda for today, because we know that time is super valuable to all of you, we have a lot of information to provide. For that reason, we will be using the chat feature in WebEx for you to, as attendees, to ask questions. So we've compiled a panel of all of our experts and all of our speakers here from each of the areas you'll hear from, and they are available to answer select questions as they, well, all of your questions as they come in during the session. We're going to do our best to answer as many as we can. So use that chat feature. We highly encourage you to use that as you have questions. Please submit your question to all of the panelists so that they can see and determine who best should answer your questions. And when we answer questions, if applicable, we will answer them for all of the providers to see and learn, because all of your questions are super valuable to all of us. We are recording today's event. It will be posted to our webpage, hopefully within a week or so. I just want to state that out. It seems It would seem easy to me to like post a recording right afterwards, but just let me assure you, it's a lot more complicated than even I thought it could be. So we have a process we have to go through to ensure that our recording is accessible and fair to everyone. And so we're very committed to doing that in our agency. And we are so it takes a little time. So bear with us. We will get the recording up to our webpage hopefully within a week or so. Um, so just know that and look for that when it's available. It will be up on our Child Care Center licensing webpage under the news and updates section. Today you'll hear from various experts. Um, Peggy Cunningham will be here. She's our manager from the Child Care Center licensing unit, and she will be talking throughout the presentation a couple different times to share some information. And then we've also got, as you can see here, a lot of topics to cover. We will be sharing information about the child passenger restraint training because there's some changes from CARS to a new training called BEST. We have licensing reminder and an update. We'll hear about the legislation that was passed and is in effect from 2024, as well as some ideas of the upcoming legislative session that will be proposed. You'll hear from the Provider Hub. The Great Start Compensation Payment Program has some really new information to share. And then we have licensing expectations about documentation, some info on our forms and resources. We'll hear from background studies. We always love to have our friends from background studies here to share directly with you information from their department. And then the Minnesota Department of Health has information here on immunizations. And then we'll wrap things up with our great Mod Squad team to share with you updates on where things stand with the Regulation Modernization Project. So with all of that, I'm going to hand things over to Peggy Cunningham. She's again our manager at the Child Care Center Licensing Unit, and she's going to share some information with you from our licensing team. So Peggy, take it away.
Hello, thank you, Lisa. All right, hello everyone, and welcome. As Lisa said, my name is Peggy Cunningham, and I manage the area here at DHS that licenses childcare centers and certifies our license-exempt childcare centers. We appreciate you taking the time to join us on the call, and we're always happy to pull together this team representing various areas that touch your world into one virtual space. So hopefully it gives you what you need to provide a variety of relevant information and give you opportunities to ask questions. So thank you for being here. Okay, child passenger restraint training. So a couple of areas in the licensing realm that we want to highlight for you today include this, child passenger restraint training. The licensing requirements for this training have not changed. And as a point of reference, what we're talking about is a licensing standard that requires some people to complete child passenger restraint training, not necessarily all of your staff. And so the licensing law states that before a license holder transports a child or children under age 8 in a motor vehicle, the person placing the child or the children in a passenger restraint must be those who take the training on the proper use and installation of child restraint systems. And this training has to be repeated at least once every 5 years. So I'm sure your question is, well, then what is changing about about this training? So how the training will be offered is what is changing, effective January 1st of 2025. Currently, and through the end of this year, CARS training, which CARS stands for Child and Restraint Systems, which is a 3-hour course provided by the Minnesota Department of Public Safety, the Office of Traffic Safety. Certified trainers has been the course needed to be taken to meet this training requirement. So effective January 1st of 2025, right around the corner, the Office of Traffic Safety is transitioning away from CARS to BEST training, and BEST stands for Best Education for Safe Travel. All right, next slide. There we go. So what specifically is changing? So BEST is a hybrid training. that the Office of Traffic Safety created, intending to streamline the training process and enhance accessibility to the training statewide. So this new hybrid format will consist of an approximate 60-minute online training known as Car Seat Basics, and then with a separate in-person hands-on practice and demonstration with car seats, somewhat similar to a car seat checkup. So what does this mean for you as a child care center? So cars will no longer be available after January 1st, and individuals required to meet this training requirement will need to do so by taking BEST. But this does not mean that everyone will need to take BEST right away in 2025. Because child passenger restraint training only has to be repeated once every 5 years, you or your staff who are required to have child care passenger restraint training do not need to complete the BEST training until your CARS training is about to expire. In other words, previously taken CARS training will still be valid into 2025. You have to pay attention to the date that it was taken, and it will be valid until 5 years from the date that it was taken as a CARS training. I'm sure you have questions about this, and so there are lots of resources available for you to dive into it and figure out how this is going to work for you and your staff and in the area that you are in Minnesota. So more information about the transition to BEST can be found on the Minnesota Safety Council's Child Passenger Safety website. That was a mouthful. Once you're on the Minnesota Safety Council's website, you'll want to scroll down. There's a header that reads CARS is transitioning to BEST. Here's what you need to know. So you want to scroll down there. And a link to that website is included in the handout that Lisa referenced a little bit in the beginning that is posted to our Child Care Center licensing webpage already. Okay, a couple of other things we thought we needed to highlight here for you today regarding 2025 licenses. So I just want to shout out a reminder that if you haven't yet paid your license renewal fee for 2025, you will want to do that soon, like before your current license expires, which is December 31st. So if you have not made this payment yet, submit your payment as soon as possible to avoid a delay in receiving your 2025 license or in your ability to operate in 2025. Also noting that payment must be made in the provider hub. Calling out to that, on December 2nd, a GovDelivery email communication was sent as another reminder to do so. The communication included instructions for making the payment and also included contact resources if you need some help in doing that. If you have questions about it or need assistance with making your payment, you can reach out to the Provider Hub Product Experience team or submit a case directly in the hub. And this information was also included in the December 2nd GovDelivery message. And I see that Laura already put a link in the chat here for you to that communication for easy reference. So go there if you haven't paid your fee and you have questions about how to do so. The information should be there for you. Okay, and the other piece that I just wanted to share with you, which we feel is good news, is that we've been fortunate enough to add a few more licensors to our team. And with that, excited to share that it has allowed us to lower the number of centers assigned to each licensor on our team by a little bit. With the addition of more licensors, of course, comes the need to create additional caseloads. And as a result, existing caseloads have been shifted a bit, and some centers may have a different licensor after the first of the year. So we wanted to just point that out to you and let you know that if you will be working with a different licensor, you will receive an email notifying you of the change. And also just to reiterate that you can also see who your licensor is through the Provider Hub.
Thank you, Peggy. We'll see you again a little bit later in the presentation. And now we're going to have Karen Kunze come and share with us. She's a policy analyst with our licensing division. She will talk about the legislative update from this past year as well as things to come. So Karen.
All right, thanks, Lisa. Next
You bet.
slide. We're going to start by just talking about a couple of things from this past legislative session. So just a reminder, I think we talked about it at the last webinar, but the 2024 Legislative Implementation Plan is out. I'll put a link to it again in the chat just for easy reference. You can also find it on the website. It was sent out in June. It's on the website, like I said, in a couple of places, and it's also linked in the outreach session handout that Lisa created. Keep in mind that this year there were a variety of effective dates, so many of them have already passed, but some are still to come. So just as you look at the implementation plan, make a special note of the effective dates. Next slide. So just a few things from 2024 that we want to highlight. One relates to the new Department of Children, Youth, and Families. So as you know, next year, Child Care Center licensing will move to the new agency, to DCYF. And that's anticipated to happen in June of 2025. So in preparation for that move to the new agency, excuse me, the legislature made technical changes to many parts of statute. The most significant of which is they created a new chapter for the licensing of child care centers and family child care and child foster care and the programs that will be moving to the new agency. So with that, we can go to the next slide. So this means the licensing requirements are the same, but the location of where to find them is changing. So these changes go into effect when the transfer happens next summer. And so after that point, the licensing requirements won't be in 140 or in 245A, they'll be in 142B. This does not impact rule, so rule 3 will remain the same as is, but the licensing requirements in statute will be moved to this new chapter. Recently in November, the reviser's website was updated to reflect the new locations, even though those aren't effective yet. So we sent an email out in November to providers to explain this change. And I'll put that in the chat now, so you guys have that again for easy reference. In that email, we also linked to a crosswalk document that we created. So moving forward, you can see where the requirements currently are in 245A and where they will be in the new chapter. I see there's a question about, can centers order a print version of the chapter anywhere? I believe if you have done that previously, if you wanted to order like a book like this that has the requirements, it would just be the same process that you've done before. So if that answers your question. All right, another thing I want to call attention to from 2024 relates to public email addresses. So beginning on January 1st of next year, the email address that license and certification holders provide to the department will be public data. And that you will have the opportunity, centers will have the opportunity to choose what they want their public email address to be, but you don't need to do anything right now at this time. We'll be providing instructions in the coming weeks about how to enter your chosen public email address in the provider hub. And then the plan is for in early 2025, we'll make updates to licensing information lookup to LIL in order to display the public email address for each license or certification holder. Next slide. So now I'm going to shift gears and talk about ideas for the next legislative session. Next slide. So we're in the final stages of kind of developing and vetting our policy and budget proposals. So as we go through this, just keep in mind that the language being presented today is still a draft. And we're working towards the legislative session, which begins just about a month from now in January. Next slide. So the first change, potential change, relates to the child passenger restraint systems training that Peggy was talking about earlier. This change would align with legislative changes that were made this year in the Department of Public Safety part of statute in section 169.685 that require children up to age 9 years old to use a child passenger restraint. So we want the licensing language to align with the language in 169.685. So on the next slide, you'll see the potential language. Again, this is in 245A.40 subdivision 6. And the only change would be in that first paragraph, changing it from 8 to 9. So before a license holder transports a child or children under age 9 would be the new language. And again, that would be to align with the other parts of statute. And that would be effective January 1st of 2026. Then another proposal we're looking at is one more piece of cleanup related to annual and calendar year. So as you guys probably know, annual or annually has a very specific definition in 245A02 subdivision 2, means prior to or within the same month of the subsequent calendar year. In recent years, we've adjusted language in statute to move away from the use of annual or annually and be based on calendar year instead. We have found a couple of places over the years where we've accidentally overlooked a reference that should be changed to calendar year. So here we are again with one more area to correct. So on the next slide, you'll see where that is. So we're looking at 245A.41 subdivision 3, the language around emergency preparedness, and just changing that from annually to each calendar year. Next slide. Next, we have a potential budget proposal related to the Child Care Regulation Modernization Project. So the Child Care Regulation Modernization Project has been extended due to two factors. One being the fact that the weighted risk system and abbreviated inspections will not be implemented until after the provider hub is operational for all child care service classes. So as you may have heard, the family child care providers are still being ramped up and getting ready for them to come into the hub next year. Then the other factor is the revised licensing standards will now submit a final draft in the 2026 legislative session to allow for more time for stakeholder engagement. So that'll be a full more year of work on that process. So in order to continue the work on all three components of this project, DHS is asking for additional operating funds to be able to continue to maintain the current level of service and enhance future training implementation and continued stakeholder support. Next slide. Then there are a few things related to federal compliance. So Minnesota needs to follow the requirements set forth in the Child Care and Development Fund. Currently, Minnesota statute specifies that substitutes and unsupervised volunteers must complete ongoing training in certain topics, but it doesn't specify the number of hours. Last year, the Federal Office of Child Care, the OCC, conducted a site visit in Minnesota and determined that this wasn't in compliance with the CCBF requirements and said you really need to specify a number of hours. So this proposal specifies that substitutes and unsupervised volunteers must complete a minimum of 2 hours of training each calendar year. There's no change to the training topics or frequency or who has to complete the trainings. It's really just specifying that number. And given the topics that substitutes and unsupervised volunteers are required to take, we think they should have no trouble meeting that minimum of 2 hours. Next slide. So here you can see where the language changes would be related to this proposal. So we're in 245A.40 subdivision 7, the in-service training area. And you can see it's just specifying for substitutes and unsupervised volunteers must complete a minimum of 2 hours of training each calendar year. And then the training must include the requirements for those topics that are already they're already required to do. Next slide. The other piece of federal compliance relates to licensing information lookup. Earlier this year in the spring, the Office of Child Care updated the CCDF rule, and the updates now require all items that are reviewed at a visit be displayed. So that includes areas of compliance and areas of non-compliance. Currently, LIL shows areas of non-compliance and then links to a full checklist. So we're preparing a 2025 budget request to support the IT changes that are needed to LIL in order to come into compliance with that updated CCDF rule. And as we do that work, there will be opportunities for all of you to weigh in on how you think the information should be displayed and how LIL should look. So stay tuned for that process. And with that, I'll turn it on to the next person.
Yes, thanks. Thanks so much, Karen, for all that information. And we've got Laura Lewandowski. She's a change management lead now here at the Department of Human Services, and she will share with information on the Provider Hub.
Thank you very much, Lisa. Hi,
Thank you.
everyone. My name is Laura Lewandowski. I am the change management lead for the Provider Hub, so the agency and Provider Hub activities. If you can go to the next slide, please. Thank you. So some of you may have seen this before, but it always is nice to refresh ourselves. This is the umbrella of activities that falls under the Provider and Agency Solutions product. So as we are talking about the Hub or CCAP or Great Start, Wayfinder, all of these are just components, or we also may refer to them as work streams underneath this whole solution product line. And I am representing that OIG product group on the right there. So really focusing on the licensing activities, including the agency hub, provider hub, program integrity, and then also the activities that will be associated with ELISI, legal appeals, and LIL. Underneath there, I think it's really important to point out that although we are working, because it's so complex and there's so many pieces that go into this, there are different dates that we're releasing functionality and different teams working on that, each one of those. But underneath that is our product experience team. We like to refer to this team as PET. That's a quick, easy way to remember it. And we love our acronyms here at the state. So if you hear about that, that's what we are talking about. But this team is really for you. This is the resource when you are having system problems in the hub, when you are running into questions, if you're using the hub correctly or you can't find something in the hub, they can help put you in touch with the resources. Or if it truly is something that needs to further research or might be a defect or something wrong with the system, they have the power to log that. And you can see from this graphic that because they extend across all groups, they really have that holistic end view. And they understand and know what might impact other areas and also what other issues or things might already be occurring. So they have that line of sight, and we by no means are saying do not talk to your licensor, because you need to. They know the requirements and you have that relationship, and they have a lot that they're doing for you day in, day out. But this is really specific to the tool itself. And we recommend this because that's the fastest way to get something on the radar of the team. And as we see these things come through, it helps the technical teams to really understand the severity of issues, the urgency, the frequency. And that is going to help us with our prioritization as things are getting worked on. So next slide, please. Thank you. This is our nice little roadmap here. And as you can see, we're just kind of chugging along down the track. We are a ways away from April of 2023 when we first started some of this work. And upcoming this spring, you'll be hearing more around our Child Care Assistance Program, or our CCAP, and use of funds report functionality. And the team that I mentioned, the OIG team, we are focusing on that family child care provider lens phase 3, as we're calling it, in summer of 2025. And this is expected to be a phased rollout, and we don't have details about which which ones are going, which regions or counties are going first yet. That is still in the planning phases. And we will definitely be back here to communicate that to you and to others as we know more. But that is still on the plan. And then after that, we are extending it to other licensing types. And then, of course, continuous improvement and maintenance as we go. All right. So I think this is also a great opportunity to remind you all where some resources can be found. Many of you have already accessed the Provider Hub, and so some of the information on our Provider Hub landing page on our website might not be as, to the level that you are using the system, which is why the product experience team number is there, because that really should be your first contact. One of the things I would love to call out here is when talking with the product experience team, they're going to want to know your name. They're going to want to probably know additional information about the situation you're encountering. So consider what you were attempting to do, what happened. If you have screenshots and you know how to do that, that's always helpful as well. But one of the things that we've heard recently is some concern around needing to have follow-up. The product experience team follows up, and then it's a little bit of phone tag back and forth. So when you're calling, have your calendar available, or think about some times that might work for them to reach you. Maybe it's just a 10-minute kind of time you set aside in your day. Maybe it's over a lunch hour or something like that. So whatever might work for you, have that time in mind, because that will just hopefully help everybody connect when there is follow-up that is necessary. And then on the right-hand side here is the Provider Hub. So you can see a screenshot of the landing page. This will have good information for you. It will also have this phone number, and it does have links, and then you can find how to get to the login page too if you need it. And I always love to throw out a little pro tip. Save it as a bookmark, star it, whatever you need to do so that you have easy access to it. You don't have to go digging for that link. I have tried to go into the licensing pages and just organically try to find it, and it can be a little tricky to navigate there. So sometimes it's just easier to do that quick bookmark. All right, thank you. The Provider Hub personnel documentation expectations. Admittedly, I am not an expert in the technical piece, and I don't have the granular level of details that many of you might have with questions, but please feel free to drop the questions in the chat or ask, and I can commit to bringing that back to the team and finding an answer, and then working with Lisa to make sure everybody has the answer and access to that information. But we just wanted to take a moment to remind everybody kind of the journey that we've been through. So as this was rolled out, there were some things that were identified as issues. As the team started working away at that, they found a lot of these things are connected, and that it would probably be best to work on a redesign effort so that everything was working and issues were addressed and concerns were addressed. So this effort has been going on for a while, and the team is still working on that effort, but making great progress. So just a friendly reminder that currently when you go to the licensing section, you enter personal information in the hub only for variances. And so we know that we want to get to the point where, this truly is the one-stop shop, but it's iterative. And over time, we will definitely have more available for you and information about what some of that new functionality will look like. But for now, just focus on it when you have a variance. And then the second point here is, if you are participating in the Great Start compensation, just remember that you need your first and last name when you are in and entering that information. So I don't know if there are any questions. I'm just going to check the chat here for a moment. Oh, a lot of questions about recording, and yes, we are recording this. All right. I'm happy to answer any questions if people have it. Thank you for the time, and I look forward to working with you all.
Thank you, Laura. And just as Laura mentioned, the Great Start compensation support payments is something you do through the hub. And so we have a lot of really new information, new and old, I guess, from Dana Ellingson. She is one of the specialists with the Great Start compensation program, and she will give you much better details than I would have. So I'm going to pass things over to Dana Ellingson, and she's going to share with you about the Great Start Compensation Support Payments.
Hello, I want to make sure you can hear me before I start talking away.
Yes.
All right,
Yes,
hello,
thank you.
Dana here from the Great Start Compensation Specialist for DCYF, Department of Children, Youth, and Families. I'm going to shorten Great Start Compensation from here on out. Our whole program name is the Great Start Compensation Support Payment Program, and it's a mouthful. So do my best here to update you, but also do know, I'll talk about it in a bit, but there was a gov delivery message that went out yesterday around 11:30. So when I refer to that message, that email that went out, some of you might start digging for it. It came in at about 11:30, 12:30 yesterday. And these updates that we're sharing will, most or if not all, are included in that email. So lots of links to things that are inside that email that I'm talking about today. Here we go. Let's go into the next slide.
I just want to interrupt you and say we did include that link to that document that you're referencing, that gov delivery that went out, in the handout. So
Thank you.
that's another good place to be able to find it. So
Look
it's
for it.
there.
Perfect. Thank you so much.
Thank you.
Next slide. Just a little bit about our team. I wanted to share our team is growing at the Department of Children, Youth, and Families. On the across the top here, I am positioned in the second circle, but Roz being our program supervisor, and next to me, my counterpart, Nolan Fine, who, if you've done some communication with the Great Start Compensation team, you might have heard from us too. And then we also have product managers. Product manager of the enrollment and attendance feature found inside the Provider Hub is Todd Dede there, and next to Todd is Moses Nempa, who goes by Mo, and he is our Great Start Compensation application and also the use of funds report product manager. So just wanted to give you the images to who is who. I think visuals help tremendously, and want to bring our team to you in a more visual way. And along the bottom, we have individuals answering questions that will populate into the chat feature. Those questions or responses will come from our Slalom team, who's a contracted team that has helped really bring all of this your way in an amazing way, I think, focusing on providers at the forefront and making sure we get products to you that are helpful and you can be successful using them. And Alex, Hassan, and Allegra, actually I shouldn't say their last names because I've never really pronounced them out loud before, but Alex and Allegra are here to help. Let's move forward to the next slide. I think you've seen some of these images where we come in along on pathways, starting on the left-hand side. The Great Start Compensation Payment Program once was a grant program, now is a compensation payment program starting in October 2023. And we moved into the Provider Hub, piloting a group of individuals that started using the application feature and seeing the enrollment and attendance feature eventually in June and July here of this year. So you all started applying. You could also see that enrollment and attendance feature, both those features populating inside the Provider Hub. But we're here now. We're moving into some new features, so the enrollment and attendance bulk upload and the CCMS, I'm going to say that's Child Care Management System, and I'm going to move to using CCMS moving forward, but that's Child Care Management System integrations. And that's where we're at right now. We're doing some enhancement piloting, starting a pilot tomorrow on the use of the enrollment and attendance feature, and we move into continuing our work. And so along this line, you'll also see the use of funds report is coming down below on the far right, spring of 2025, the use of funds report coming into the enrollment and attendance requirement connection inside the Provider Hub, and moving licensed family child care centers eventually to the hub, and they'll be able to apply, but not yet. So yeah, let's just keep moving forward to the next slide, and we'll start with updates on the use of funds report and the Provider Hub enhancements that are happening. The first slide that I have is a grounding slide again, just to get us in the mind frame of what are we talking about. Great Start Compensation Payment Program. When you apply for these compensation payments, eligible providers apply and also agree that they will document how they're using the funds and be able to share that with the state when asked. And that time is coming here. Along the bottom, you see you've been applying. We've been building out this use of funds report and communicating with you that this is coming, trying to provide some tools that I'll show in the next few slides here. But eventually, that use of funds report is going live no earlier than April 1st, 2025. And that email will also describe some more detailed information about that. I just want to make sure, although this is focused for licensed child care centers, that we remind everyone who is here, again, licensed family child care and tribally licensed programs are not yet in the provider hub, so they're not receiving their applications via the hub. They're coming to them via email. So another reminder there that we're doing our best to get everybody along the same way, but we're not quite there yet. Let's go to the next slide to talk about the why of that use of funds report that's coming your way. We just want to make sure to go over the key objectives that we found for the program using the use of funds report as a way to collect the information that you have agreed to offer, but there's important pieces of why. So one, to report the impact of the Great Start compensation payments. It's both a requirement, but it's important for us to speak to why the program makes a difference so that we can make informed decisions on behalf of the program. Also, a second key objective that we identified is to improve support for you, early childhood educators and providers in the child care industry. So we'll assess that information gathered from the report to learn if that funding is making the impact intended and identify other areas of need that we might need to expand on. We also want to ensure responsible use of funds in Minnesota. So wish to be good stewards and use these funds to keep the trust of those that are in our state. Moving to the next slide. I mentioned there was an email that was sent out recently yesterday, but we also sent out an email through the Gov delivery system on August 6th that gave links to tools where this could help you potentially prepare data that will be asked on the use of funds report coming spring of 2025. And these can be accessed anytime on our website and web page there. So I just want to make sure we remind you that you could go back to that email in August 6th for the links, but they're also in the newest email that was sent out where you can find those tools. The next slide digs into the fact that now we have PDFs that give you more visibility, a preview into what the actual use of funds report will look like. Many people have been asking, well, what questions will you be asking? And we are getting these to you now in the form of a PDF of what that looks like. The use of funds report is not yet available, but this is what it will look like. We're going to give you a preview here next. Again, a reminder that the use of funds will be required once a year. It will not be a monthly report that's asked. It's a once-a-year report starting in spring of 2025. And I should say it would start for those that started receiving funding back in October of 2023. If you are just now starting to take payment compensation payments, you probably won't have that requirement right away because we don't ask that you report on it after you've spent it, and you have some time to do that. So just keep that in mind. If you're new to this, that might not be something that comes about for you right away. All right, this first slide here is one of those examples of the PDF that you'll see on the left-hand side. So it's a little small. I don't like a lot of words on screens, but it's necessary today. About this section, the very first page will have your information on it that's pre-populated about the program that we're asking about, the business license we're asking about. And then it'll say, here's how much payment amounts you received. And on the right-hand side of that, it'll say, and this is the date that it was issued. And so this will help you understand the months for which you're reporting on. There will be no action for you other than to say at the bottom on the total, does this match my records? Is this what I have for what was paid? Because we want to make sure we're clear on that dollar amount, and we've given direction on who to call if that amount is not correlating with your records. So that's the first step, first pages. Let's move to the next section, and the next slide will show you, now that we've identified how much money has paid, that gray box there says total payments received. That's the number that gets populated from the previous screen. And then we ask questions on how did you use the funds? You will share in the boxes how you use the funds. For an example, was it salary increases? Was it hourly wage increase? Were there bonus payments that were paid out? And so you'll enter those dollar numbers for each of those cells, and they'll populate at the bottom. And we're hoping to see that the gray box equals the total funds used box. If you do enter into the other box, we will ask for a description, as there shouldn't be any other reason you would use these funds other than the boxes provided. However, sometimes providers might interpret this a different way, and we want to double check. If you have other, we ask why, and we'll follow up to say, oh, we think it goes into this box, or let's support you in finding out why we might have used it in another way. So we'll move forward to the next slide, which is another section on the use of funds report that we ask for you to share your overall experience with the Great Start Compensation Program. That'll be important to go back to that. How are funds being used, and is it been helpful? And was actually, I think we're ahead one slide. If you go back one, thank you. Yeah, so this section is more of like a survey question where we ask you to answer, do you agree, strongly agree, neither agree, disagree, that kind of questioning. And the format on the Provider Hub will look a little different. So this is the only way we could present it today, as it's not fully built out. And it'll be a question of, do you agree, not agree, and in between. Next slide. Thank you for moving back. But this one is another question that we ask, which is hiring and retaining staff. We want to find out a total number of people that are employed in the current positions, and how many additional people would you like to employ? Like if you could, but you're not, how many infant teachers would you like to have for this program? How many do you currently have? So the format, again, will look a little bit different, but the question's the same. That will come out for the use of funds. All right. So let's see here. I do see some questions populating. I'm hoping that someone could, we've got some individuals working on that, and I want to let you know we'll work on those questions, and we'll get back to you with what those questions are here throughout. I can't answer them as I'm speaking, and our team's having a little trouble seeing them, so we'll get them as soon as possible. I'm excited to be able to answer. All right, this slide, again, tentative timeline here, but we're getting closer to defined dates and months. But as we look on this timeline, on the far or left, it says we're here. And actually, we're almost into winter. We're approaching. I can't believe it's already December. But our team is in discovery right now, finding out feedback from providers. What do we need to know that will helpfully support individuals in completing the use of funds report and getting the report built. Now, I'm going to bring your eyes to the middle that says in winter 2025, we have in January, actually, an application update to the substitute hours, external substitutes on your application. But I'm going to pause talking about it. I'm going to move your eyes to the far right of spring, and I will come back to the middle, because I want to go into the next slides after that. But this far right shows that we have a supplier ID functionality that's going to show up on the Provider Hub section of the use of funds report, and also a new support phone line that's coming. We're excited about it. It's really going to affect and change our technical assistance team to support providers better in a better way. But the phone number eventually will change for the Great Start Compensation Payment Program, and we'll make sure to communicate that as early as possible, and also keep the old phone line open for a bit with notice of what the new phone number is. But that's a change. Wanted to let you know about it. And then again, as I've been talking about, the use of funds report coming spring of 2025. I'm going to shift your eyes back to the middle again to that application update, because it's important to talk a little bit more about it in depth. So in January 2025, instead of adding external substitutes as staff on a roster to add your time or their time working directly with children for the Great Start compensation application, we are going to have an external substitute card or one cell inside the CSV upload, if you're using that method, where all of those external substitutes hours are being collected in one space. Of course, we are asking that the each individual provider keep records of those individuals and the hours and everything that needs to be kept for program requirements of Great Start compensation, but we are asking that they're added to one card. And this is based on feedback from providers and from other work streams to support you best, knowing that you might be directed differently from your business license roster from licensing units. So let's move to the next slide to dig in just a little deeper, fine tune this a bit to things I want to make sure are concrete, that the Great Start compensation application requires providers to add individuals to their personnel list, adding only their first and last name. And that's important, only first and last name for licensed centers. You do not need to submit personnel for approval. So apart from the personnel variances or direction from your licensor, do not add or do not submit these individuals that are being added first and last name for approval. I'm going to show you a snippet of what that looks like. But once the staff's first and last name are entered, the newly added staff member will show as action required, and that is okay. That's the way that they can stay inside the business portion of the hub. And at the Great Start, they transfer over and you can add their hours once you put their first and their last name in. So, but note, I just showed you that starting in January, external substitutes, and we'll talk about who those individuals are, will not need to be entered individually for Great Start compensation application into the business portion of your provider hub. They will be added to a card in the Great Start compensation application. So no longer needing to be in there individually. So let me show you a screenshot. Again, screenshots are difficult because they're a little small and blurry, but in general, you'll see first and last name at the top are the red asterisks that say you must enter these, and then you will hit submit. You do not need to enter any other information at this time. And the next slide will show you that what I described as, then it'll populate the individuals and say action required. That could cause alarm, but again, that is okay. That's what they should look like in there, and you do not need to do any action, as it's saying, as you're not directed to, unless, as I mentioned earlier, you have some type of personnel variance or directions from your licensor. So wanted to make sure we clarify that as we're working with different work streams and supporting in the best way we can. I hope that gives better instruction. Let's move to the next slide of the Great Start compensation functionality. Again, coming this January, providers and licensors gave feedback and helped us to improve the ways that we're reporting hours. I mentioned external substitutes in being added to one card. On this slide, it's just talking about that the functionality that's appearing and what the benefits are to you. And I want to talk about what the difference is. So an employee of a program would be in a formal employment relationship with a child care program. That would include even employees that float or serve as internal substitutes, whereas an external substitute that's going to be added to these cards would be an adult who is not in a formal employment relationship with the child care program and provides care for children on an as-needed or requested basis, usually from an outside organization that you ask to have people come in and work. So external substitutes are different than employees. Please reach out to us if you need clarification on that as we're supporting individual programs and understanding the difference of some of those that are working with children. But external substitutes are those that are not in a formal employment relationship with a child care program. Woo! All right, I am moving to the next slide and hoping everyone's following as I know I'm moving quickly through this information. Again, a lot of this information you can go back to the handout for today and also the email that was sent out and reach out to us for support. This slide here, Great Start compensation application, this is that preview of if you were adding external substitutes onto a card. You'll see that now the name says external substitutes. You can't change that name, but you're going to be adding the FTE value of all individual, or the hours, sorry, for all of the individuals that were considered external substitutes for that month on the card, and it'll give a total FTE of external substitutes. Again, I mentioned you are acknowledging that you are not reporting more than 2 FTEs per week, but you're keeping the records of these hours, names, hours, and the dates of service that were given directly to children on site, and you'll have those records kept on site. Yeah, so hopefully that it's helpful to see that image. Next would be if you're using a CSV upload. So instead of a personnel card, you are using a CSV upload. You typically see names that populate, or you enter those names and you see external substitute as one of the cells there. You're going to be adding the total amount of hours there that are worked instead of putting it into the card. So two different ways that providers are entering in staff hours. Wanted to show you what that looks like now with the functionality. Okay, oh boy, I need to keep moving. Let's see, again, this functionality coming in January. You have the ability to add external substitutes. It can be an external substitute on a CSV card or in their entry into a, CSV line or in the card. And then there eventually will be an option to connect enrollment and attendance data to applications, but in that email that was sent out, that connection for your enrollment and attendance data to your application is happening first as an option for certified centers. Note that that option will not appear yet for licensed centers, but it is coming. Okay. I think there's a slide about questions or comments where we kind of slow down a bit, but I think that's actually happening in the chat feature. So I don't think we have space for that yet, but I'm going to keep looking at the chat feature and see that my team's answering some questions here. Okay. Well, let me pause here. Okay. I'm going to keep moving along, and I'll come back to the questions here at the end. Enrollment and attendance feature. So in the Provider Hub, there's an enrollment and attendance feature that's been there. It has been optional. It includes a kiosk for families to sign in and sign out if providers want to use that. And now we are integrating with some childcare management systems to allow enrollment and attendance data that's in a childcare management system to be shared with the Provider Hub enrollment and attendance feature. The bulk upload template has also been worked on and will be available for individuals to use. That would mostly be for individuals who don't have a CCMS that is integrating, but they want to bulk upload from their CCMS into the enrollment and attendance feature. Know that in the future, the connection of enrollment and attendance data to the Great Start compensation application within the Provider Hub will happen, but at the bottom you see that it's currently providing electronic enrollment and attendance data. It's not required right now for the Great Start compensation application. However, it will be at some point. We will communicate as soon as possible when we know that when that is happening. Next slide, you see those CCMS childcare management systems that vendors that we are currently working with. And along the bottom again, we're in a pilot of those vendor integrations starting next week. And the digital enrollment and attendance requirement will be in the future. But these are the individuals we're currently working with. The next slide digs a little bit deeper into, again, what's coming for enrollment and attendance feature in the Provider Hub in January. In January, providers can upload their enrollment and attendance data. This often, again, is for providers using paper or electronic worksheets or providers with a childcare management system that's not currently integrating. That list that was on the previous slide of the 5, also note that not all 5 will integrate at the same time. And so there may be integrations eventually for your CCMS, but you're not quite there yet. So you try the bulk upload. The manual entry and attendance enhancement have also been made where providers can multi-select children and also edit accounts for blended families. Down below is where the child care management system integration is happening, where we're going to be able to connect child care management system information to the enrollment and attendance feature in the Provider Hub, happening with those 3, I think, that are connecting in January of those vendors listed. The next slide, we show that. So on the next slide on the far right, it looks like AREX, Brightwheel, and Daily Connect are going to be integrating in January, where information can be uploaded into the enrollment and attendance feature inside of the Provider Hub, again, being an optional free feature that's there right now. Again, currently providing electronic enrollment and attendance data is not required. However, it will be connected to the Great Start Compensation Payment Program at some point, and additional CCMS integrations will be made, and we're continuing to make connections with those vendors. Next slide. The data elements listed here are to help ensure the information is supporting future automated calculations, enabling the features to be able to work, like the parent guardian kiosk and the enrollment and attendance features. So these are the enrollment data that's collected here. I wanted to make sure you had this list that for children, it's first, last name, date of birth, and enrollment start date. And for parent and guardian, it's the first, last name, and email address. And for authorized adults, first and last name. All right, whew. Now we have some time for questions. I think I'm just approaching my absolute time limit, if not past it. My apologies. Let's see. Let's see. Yeah, I think I'm going to move on to others that are presenting, and then we'll start answering some of the questions here in the chat feature. Is that okay?
That sounds good. And yeah, so hopefully at the end, if we haven't answered everything in the chat, we'll be able to pull back and answer verbally as well. So
thank you so much.
We'll just
That's
keep moving.
important.
Thanks. Thank you so much, Dana. All right. Dana, you had a couple more slides here. Did you want to?
Yes, I am back. Sorry, there's just a few more slides that talk about things that are also coming your way on training. We are designing a go at your own pace, easy stop, start, quick reference too. We have user guides, click-by-click written PDF guides, interactive learning where there's scenario-driven learning, and also some self-serve knowledge articles in the Provider Hub. And always, can you submit a question in the Provider Hub? We monitor that daily, so do know there's on-demand help, and we are continuing to work to meet the needs based on feedback from providers and pilots, and outside of that, of how can we serve you best? So do know that that's available. The next slide gives that visual of where you can use help and resource to find out information and also ask for support and assistance. Always can you call the Provider Hub helpline. I think someone referred to as PET earlier, but Provider Hub helpline has availability to support you. And then also it says Child Care Aware helpline. That's our contracted individuals helping to support the Great Start compensation for technical assistance. All right, I hope there's not another side, and if there is,
I'm going to move right past it. All of the information, like the links for more information on everything that Dana shared, is available in the handout for today, which again is posted on the Child Care Center licensing webpage, and the link is in the chat. So that was a lot of information, but a lot of really important information, and I appreciate hearing from both Laura from the Provider Hub as well as from Dana from the Great Start Compensation Payment Program. With that, we want to wrap things up from the licensing perspective. So Peggy's going to come back on and share a little bit more with you about our licensing
Yes,
viewpoint
thank you,
on all
Lisa.
of this.
Yeah, a lot of information, so, but it's great to get all of these questions, and we will hopefully, like Lisa said, have the time to address them by the end. So this is really going to be pretty short, I think, and really just wanting to focus on the documentation expectations related to personnel for licensing purposes to make sure there are clear expectations for you as a provider. We know it sometimes gets a little confusing when, okay, what do I need to do for Great Start, and what do I need to do for licensing, and where am I, kind of a thing. So you've heard from Laura with the Provider Hub team talk about the progress that is being made on the personnel redesign effort, which we are all super excited about, because that will hopefully in the end make this all much easier to use and make it very clear what you need to do. And also from Dana with the Great Start compensation payment team, talk about what they need specifically in their Great Start application. And so for me, I just want to reiterate that for licensing purposes, you do not need to submit personnel in the hub except when you're requesting a variance for personnel. And so until that redesign of that personnel section in the hub for licensing is completed, notices of reinspection for your upcoming licensing review visit will continue to come in the form of an email from your licensor. And we'll explain that if you are requesting a personnel variance, to do so in the hub. Otherwise, for purposes of your licensing review, the reinspection notice will continue to request personnel information forms, summaries of personnel, and staffing patterns. And also this email will include a link to a related support article about submitting personnel variances, and we'll refer to instructions that you can find within the provider hub for doing that. So if you haven't had the need up until this point to request a variance for a staff person yet, know that there are resources to help walk you through the process.
All right. And then it's me, because as a training specialist with the Child Care Center Licensing Unit, one of the things that my colleague Rena Henjum and I oversee and look at are the forms and documents that we have on our Child Care Center Licensing webpage. And we know that many of our programs are very aware and use our forms and documents to help with organizing and tracking various document requirements already. But for others out there, you may not be aware of all the various forms and resources that we have for years created to support license holders in better understanding various requirements. So as you are preparing for your, with your, well, just ongoing at all times, any of the documentation that you need to do, or just having a better understanding of requirements such as training requirements for various roles within your program, we have forms and documents available for your use. And so as until the provider hub is fully functional for you to enter all of that information, and even when you're preparing to do that, the use of these forms and documents and resources should be something that you're aware of. And so again, we're very aware that many of our providers use these, but just if you didn't know, please take a look around on our Child Care Center licensing webpage. We have a section called Forms and Other Documents. In that section, there are forms that are required through legislation or through statute to be used for certain types of such as your emergency form. There's various ones that must be used. There's also a section on optional forms that you can use to document required information. And then there are resource documents to, again, help better understand, such as, training requirements or understanding various equipment requirements in your room. So take a look at the webpage if you haven't already, because we have those available for your use. Do note that we work very hard to ensure that our forms and documents are up to date. And so when you go to use a form, instead of saving it to your computer and using it as you need it, always come to our webpage so that you're using the most recent form or document, because we work really hard to ensure that if any sort of legislation requirements change, such as after, yearly after a session, then we work to make sure that our forms get updated. And we're also doing better than we've ever done in the past at kind of perusing our forms to ensure that they're working properly. And we do take to heart when a form isn't working properly, that information, if you provide information to your licensor or through our licensor on call, that comes back to us, and we work really hard to work with our digital content specialist to ensure that they are working properly. So I'm thanking you for that feedback, because sometimes we're not aware of something that goes wrong with a form. So just wanted to let you know, so that you're aware that all of those processes are still in place for you. Now we're going to move on. I hope Jana is here. She had a busy schedule today and she was hopping on for us. And we've got Jana Nicolaisen she's a Research and Operations Area Manager from the Office of Inspector General's Background Studies Division, to share some information directly from Background Studies. So is Jana here?
Yes, I am. Can y'all
Yay.
hear me? Okay.
That worked out good. Yes, I can. Thank you.
Yes. Hi, everybody. All right. We'll just move on to the next slide.
All right.
Introduction one.
Sorry, there's a delay.
Got it. Okay. All right. So I will just start off with childcare study requirements. Some of this may be repetitive news, but every time I'm in front of a group, it's good just to reiterate. So individuals who are affiliated with a licensed or certified childcare centers must complete an enhanced background study every 5 years. So in order to comply with this requirement, new studies must be submitted and should be initiated no more than 90 calendar days before the study's expiration date. So you can use your provider roster in NetStudy 2 to check the expiration date. So we have a few screenshots of what that looks like. So next slide. So this is where you can go to your provider roster to filter as needed. Next slide. And then you can see your roster. So again, these are not actual study subjects. These are all just test case made up names, but you can see the name of the person, you know, and their affiliation status and their determination and their expiration date. So we have, you know, so you should be able to see right there when they expire and no more than 90 days prior to that date. Is it advised to submit a updated study? Next slide. So again, another screenshot about who needs a new background check. There's another way to search in NS2 as well. So there is a, you know, you can search by division, provider, all of those things, and then look, and you can see down on another screenshot if things are expired or how many days are remaining before a new study is needed. And next slide. So again, a reminder to check your rosters. It is very important to keep the rosters updated for a number of reasons, and just making sure those are active. So as staff come on, that's easier. I think it's when staff leave where we sometimes it's hard to keep track of that at times. So just again, a plug that individual employees should be separated from your roster when they are no longer employed. Next slide. All right, so just a few updates with background studies. I definitely wanted to let the group know that the Department of Human Services will continue to cover childcare background study and fingerprinting fees through 2025. So as of right now, these will be a covered cost through 12/31/2025. So it also includes household members or anyone affiliated with a childcare program, which is probably less relevant in centers, but still covers those family childcare providers. I know one of the, you know, a number of issues come up on a regular basis about IDEMIA fingerprinting sites concerns. So I just want to, you know, let people know that, you know, we're aware of concerns when they are brought to our attention. We do know that IDEMIA has had a hard time keeping sites up and running. So sometimes we have sites that do close unexpectedly or hours change, something like that, where something kind of happens on the fly and there's not a lot of communication about it. And then also finding, you know, an alternative site to help with fingerprinting needs across the state. Sometimes that isn't communicated the best either. So we're actively working with IDEMIA on those issues. The best advice I can give is when those things are popping up and things are happening, just make sure to call the call center, which is in that handout that was provided prior to the meeting, and just let them know if you're experiencing issues, if a site unexpectedly is closed when they say they weren't, anything like that. Let us know. We keep track of that information very regularly, and we're in constant communication with IDEMIA to try and work that. To try and get those fingerprint needs met. And then around the background studies contact center phone and email wait times, yes, we have had an increase in volume. I would say on average, our contact center is receiving over 1,600 emails a week and over 600 phone calls per week on average. So the volume is very high in our contact center. We do have a number of newer staff, so we are working through some bumps of just training training and executing, you know, all the roles and tasks that we have with our contact center staff. So, you know, we have a new manager in place, so we're expecting those wait times and any email delays to just continually get better. But again, if you're still just finding very long wait times or the phone, you know, calls go unanswered, things like that, definitely let me know and I will make sure our contact center is aware of that, our contact center manager, to keep an eye on that. And then probably the last thing on the slide is accessing background study documents. GovDelivery went out in November. So there is, I do have a link to that. I can throw it in the chat. But essentially effective November 13th, all of our BGS notices will be available electronically through NetStudy2 through the applicant portal. We have stopped mailing paper copies of background study notices to study subjects. However, we're still sending authorization forms and disqualification letters through the mail. So not everything is completely paperless. The authorization forms and disqualification letters are included in that. So I can make sure that link gets in the chat as well for people to review that. There's instructions on how to get into the applicant portal or, you know, like get an account if someone doesn't have one. But it's just our way to like move into the 21st century and not have things be snail mailed. They can be just viewed and downloaded and printed through the NetStudy2 portal. So next slide. Oh, that's it. So these are our hours. You can find this in the printout as well. So again, open from 10 to 3 Monday through Friday for the contact center. And I do know the childcare background studies web page is on the handout everybody received as well. So I do know there were a couple questions that popped up. So I will look into those and take those offline and let other presenters go. So thank you very much.
Thank you so much, Jana. I do want to put a little plug because Background Studies has created a lot of also really good resources too that I did include in the handout. So oftentimes if you have a question, they may already have answered them. There's a great FAQ page they have regarding background studies as well as NetStudy2. So take a look at some of the links for when you're trying to navigate background studies too. So they've got lots of good stuff. So thank you. We're going to move on. We have a treat here today too. We've got Lisa Harris from the Minnesota Department of Health, and we say it's a treat because we oftentimes work internally with our partners from the Department of Health, but this is the first time we've had Lisa actually here in our outreach webinar, and she's going to share some information from the Minnesota Department of Health on childcare immunization requirements. So Lisa, take it away. Lisa able to log in. Rena, is Lisa on?
Lisa, I can see her. I can't hear you, Lisa.
Is she in? Okay. If you might need to unmute her if she's not able to. And I can't. Let me see if I can see her. Oh, I can unmute her.
Okay. Perfect.
Maybe. Oh, yes. Lisa.
Okay.
You're unmuted now. Yeah, there you are. Sorry.
I can make it work.
Yes.
Hi, everybody. I'm really excited to be with you guys today, and we'll switch it up here and talk about immunizations for a few minutes. So we can go to the next slide. So just quickly, we're gonna chat immunizations, immunization requirements, understand the difference between what they all are, what they all mean, and what they mean for your center and for the parents. So we can go to the next slide. And especially here, we've just gotten over one measles outbreak. We're going to talk about what the importance of what the immunization requirements are and the outbreak. And if you guys have seen, I sent an email out to everybody. We just completed one one measles outbreak, and you know, the importance of everything for centers. It's out there. We've just finished one, but the risk is there for everyone all the time. So you guys know that immunizations protect everyone, the kids in your center, as well as staff, community members. Vaccines protect on a number of levels, not just measles, mumps, and rubella, but pertussis, polio, all sorts of vaccine preventable diseases. And anybody who's not vaccinated is at risk. So, you know, children in your center as well as staff. And in as far as measles go, it's a 21-day exclusion period for being out of your centers. So it's pretty important that knowing what who's vaccinated, who's not in your centers, and especially the little kids who can't be vaccinated yet, it's knowing their status. So knowing who's going to have to stay home, you know, if there's a case, if there's an exposure at your center, it's knowing who's going to have to stay home. We can go to the next slide. So we've had 68 confirmed cases so far of measles in Minnesota in 2024. We've seen decline in MMR coverage rates, coupled with the increase in measles disease nationally. It's internationally. It's usually a travel-related case. Someone travels internationally, brings that case into Minnesota, and then, you know, with the lowered immunization rates, we're going to see an outbreak, and that's exactly what we saw with this last outbreak. So reaching out to families of children who are unvaccinated and encouraging them to get vaccinated with MMR is probably the most important thing that you guys can do on your end, and knowing, you know, knowing who those kiddos are and trying to work with the families who have not received MMR is probably the most important thing that you can do. And like I said, it's kids who have not received MMR, and if there's an exposure, they're going to be excluded for 21 days or longer for measles. So we can go to the next slide. Because measles is so contagious, 9 out of 10 people, if they're not vaccinated, are going to become infected if they're not vaccinated. So measles is so contagious. It's airborne. So someone who's coughing or sneezing, if they're infected, they're going to be spreading it to those who are not protected with MMR vaccine. We can go to the next slide. So our big push this year is what we've been, and hopefully that you've seen it, is how to be prepared for measles if it comes to your center. We've put out a number of resources, and so it's ensuring that all of the children are vaccinated with MMR or have a legal exemption on file. And to save immunization and exemption records for all of the children in your center, and to make sure that their records are current and easy to look up. If we have to call you and say that there's been an exposure, knowing the status of the immunization of all the children in your center is probably the most important thing. So taking these steps to following the steps that MDH or local public health that give you to review the records of attendance, looking at vaccination records, and then MDH staff will follow up and ask for a list of children and staff along with MMR vaccine dates. So know that if there is an exposure in your center, someone from MDH is going to be calling you and asking you for information. We're going to be looking for who's been attending at your center and their immunization status. So we can go to the next slide. Here we're just showing you since 2015, 2016, you can see a decrease in our immunization rates for DTaP, Hep A, all the required immunizations for childcare. All of them have been declining. And we've got, as well as partially vaccinated kids in their immunization rates. When you guys are doing the AISR, it's not just fully vaccinated kids, but partially vaccinated, as well as the non-medical exemptions. Those have also been increasing as well. And we've got a link here that you can go and take a look at all of the rates, all the way from 2015 up until this last year of 2023-24. If you want to see the rates, you can take a look at those at that link. You can go to the next slide. So let's chat law. Everybody's excited about the immunization law. Next slide. That one's a blank. Sorry about that. We can go to the next slide. So to ensure safe learning for all children, everybody who's attending in that center, all children are required to receive certain vaccines before they enroll in school or child care. You can go to the next link. And we all know that parents can file a medical exemption signed by a healthcare provider or a non-medical exemption signed by a parent or guardian that must be notarized. Next slide. And then K through 12 school and all Rule 3 licensed child care centers have to do the annual immunization status report every year. That was just due December 1st, that everybody's probably just finished doing. And then more information on Minnesota school and child care immunization law. We have two things. There's the statute, which is the 121A.15, and the rule 4604. So there's always two pieces of information to take a look, the statute and the rule. Next slide. So we always suggest that you use the MDH Are Your Kids Ready form to communicate to families about the immunization requirements, and we just updated it this spring of 2024. Know that the AISR asks something. It asks, have children met the immunization law requirements, which is different from the CDC recommended schedule. And we always ask that you refer to the vaccine doses guide, because that's the companion piece on filling out the AISR. It's going to make much more sense to you if you look at that to fill out the report. And we know that the immunization law can be really confusing, and so for you to be frustrated and try and read statute and rule, we ask that you just call us or email us. It's a whole lot easier. We're happy to help. So go ahead to the next slide. We do have tons of resources available to you, and we're happy to show you what they are, and know that we'll walk through them with you. We can go to the next slide. The first one that's probably the most familiar to you is MIC, the Minnesota Immunization Information Connection, or in simple terms, the immunization database of immunizations given. MIC has been around for quite some time. Child care centers can use MIC to look up and print out immunization histories. You can keep a list of children in your care and look it up quickly. And then they're also available to receive assistance with the child care annual immunization status report that was just available and just done. Note that your child care center must have an active data use agreement on file with MIC in order to use it. And if you don't have one, MIC can help you go through the process of getting one. It's really easy. It's just a simple survey that you can fill out online. And you can contact the MIC help desk at that email address there. So next slide. The child care provides immunization reporting. That link there, we can help you with getting immunization information requirements and for families. And then also MIC and child care, that link there will help with knowing what to provide. The whole process of using MIC can be found on that link, as well as preparing and responding for measles at your child care center. Probably just today, if you've checked your email, you should have gotten an email from us that the measles outbreak is officially over. And we just provided that as a kind of an FYI to thank you and to let you know that that it's over. However, it's not that far away. It's usually travel related, and that responding to measles in your child care center is a really important document for you to be familiar with. So it's posted there for your reference. Next slide. The Vaccine for Infants, Children, and Adolescents website on the MDH immunization page is really important for you. You can link to all sorts of other resources there as well. Parent-friendly recommendations for immunization schedules is easy to find. The MDH measles fact sheet is there. The Think Measles poster is available to download, and you can print that off as well. And then the vaccine information statements, the VISs from the immunize.org website is available for MMR, and it's also available in additional languages if that's helpful for you. Next slide. And that's it. That's it for immunizations. So I don't know if you have any questions. I'm happy to look at the chat and see what's there and answer any questions, but you can also send email to the health.aisr@state.mn.us, and we will be more than happy to help you.
Thank you so much.
Thank you.
Thanks, Lisa. Thanks for partnering with us and being here today to
Yep,
share this
happy.
information.
Happy to do it. Thank you.
And all of those resources again are in the handout. And
Yep.
you know, as a childcare provider or educator, we know that oftentimes parents come to you with questions, and so it's really nice to be able to know of those resources that are available both for within your program and help you, as well as to maybe be helpful for the families that you work with. So thanks, Lisa, for sharing that. We're going to move on. We have Brandon Tice. He's got a lot of information here about the revised licensing standards next steps. So the Regulation Modernization Project. And so Brandon, I'm gonna hand things over to you. We've still got some time left. So are you able to unmute? Yes, there he is.
Hey, Lisa.
Hi.
Thanks for the intro.
course.
Yeah, not too much, just some quick updates on the Regulation Modernization Project. And I'm going to focus today on the revised licensing standards, since that is the most active component of the project right now. As Karen, one of our earlier presenters, mentioned, with the weighted risk system and abbreviated inspections, we are waiting for the provider hub to be fully implemented for all childcare types before we are able to implement the other two components of our project. So anyway, I'm focused on revised licensing standards today. Next slide, please. And that's essentially what this is showing. And as a reminder, we do have the regulation modernization occurring for both family childcare and childcare centers, obviously focused on childcare centers today. Next slide. Okay, so a little bit of context for those who may not be familiar. In 2021, the Minnesota legislature directed the department to work with NARA, the National Association for Regulatory Administration, to develop revised licensing standards, which, and here's the two-part thing here, which are grounded in national regulatory best practices, and which must protect the health and safety of children and be child-centered, family-friendly, and fair to providers. So sort of that two-part directive there. In April 22nd, 2024, we released the first draft of revised licensing standards for public input. It's referred to as Draft 245K, tentatively, just so we have a way of designating it right now. And yeah, we released this for public input, and that 245K designation gets at, the goal with this would be that the part, all of Rule 9503, and then the parts of Minnesota Statutes 245A that apply specifically to childcare centers would be combined into this new chapter. So next slide, please. So some feedback we received on that first draft that was released in April, just a quick recap, is that we learned a lot. We participated in over 23 different listening sessions around the state in the summer. There were about 950 participants and almost 2,500 individual ideas or post-its collected. And, it was quite the job transcribing and organizing all of those ideas, but it was very enlightening. Also in the summer, we had an online survey available to anyone to give feedback on the draft standards. We had about 1,600 unique respondents to that. And additionally, we contracted with Wilder Research, and they did some outreach to do some one-on-one interviews with providers to dig a little deeper into, what their thoughts were on the draft. So there were about 220 providers that they reached out to invite to participate in those one-on-one interviews, and then interviews were conducted with, whichever providers responded and indicated they were interested in those interviews. Next slide. So the big thing is that the key themes report is now available. And I will just put this is available on our project web page. I would encourage people to, they can check out our project website, and I can put the link in the chat for that as well. But the direct link is also in the chat that I just posted. So really would encourage you. It's about 22 pages, I think. It just summarizes what we heard from all of that engagement that I just described. Our team really, we learned a lot going around the state, reviewing those survey responses, reviewing some of the notes from those interviews. So this report is basically just our report back to you to let you know that we heard what you said, and here's what we heard. So it summarizes the listening sessions. And for those listening sessions, if you weren't able to attend one, just for context, they were organized by some key, some priority themes within the draft. So staff qualifications, training, environmental health, areas that we thought there were substantive changes or there would be interest. So for the listening sessions part of the report, it summarizes the DHS context for that section. So for behavior guidance, for instance, we briefly just describe this was the department's intent in putting forward this draft and what we were trying to change in the behavior guidance section. And then it gets into the key themes of feedback, including direct quotations from people. So here's what we heard in terms of feedback on that section. And then it gives a summary of feedback. And then there's also sections for the interview and the survey takeaways. So what we learned from those as well. So yeah, just really encourage you to check out the report. So these listed on the slide here, these are all the priority sections that we asked for feedback in those listening sessions. Just want to, you know, for the sake of time, I won't get into to too many details here, but you know, some of the quotes were around for behavior guidance, for instance, behavior plans being reviewed every 60 days. We heard that that was a concern. You know, just overall concerns around excessive documentation, the requirement to report disenrollment within 48 hours. There was cleaning and sanitizing. Some of the things we heard there was, you know, the frequency of certain cleaning, items like pacifiers, for instance. I could go down the list here, but I think I really encourage you to read the report. It gives you a good sense of what we heard. And we are working actively on the next draft. Just want to reiterate that this report we're sharing here, the key themes report, this is just what we heard and what we, you know, we want to make sure that that's clear and that's transparent. But it's not necessarily all of these things are going to be in the next draft, but this is the feedback we heard from you. Next slide. Okay, so next steps. As I said, we're working very actively on releasing the next draft, and we are still we're aiming to release it by the end of this year. We're expecting it to be published with some supplemental materials as well, including a red line copy that shows in detail what changed between the draft one and then this draft being released, so you can see those changes, as well as a summary of significant changes that were made between the two drafts. Once that is released to everyone, January through June, we anticipate another round of public engagement. So TBD on exactly the format this will take. Those details will be released when we release the draft, but we're really looking forward to going out there and you know, again, learning from all of you, taking that, incorporating it, and making a stronger draft. So after we do that public engagement in the first half of 2025, we're going to analyze that feedback again, create a stronger draft, and that will be what our team anticipates sharing with the Minnesota legislature in the 2026 legislative session. So plenty of time ahead for us to keep learning from each other and to keep, you know, strengthening the draft to make sure that it works for everyone involved, for Minnesota's childcare community, providers and licensors and parents. Okay, so that is the timeline. And then this is just another view of the timeline. As you can see here, we're at the December 2024, planning to release that public draft 2, and then we're gonna continue to move forward with additional stakeholder engagement at that point, and another draft as well after that. So that's all I've got. And there is our project email. I think this is in the handout as well. And thanks everyone, and take care.
Thank you, Brandon. As you can hear throughout this entire presentation, there's been a great focus and I think a really great observation of the commitment of all of the people that have been here today to work with all of you. So this today's webinar is that opportunity again from our Child Care Licensing Division and our Child Care Center Licensing Unit in particular to connect with you, to, you know, gather some of the people that we know through the feedback we've received from a lot of our license holders about information they've wanted to hear about. And so that's why we pulled together everybody for these Child Care Center licensing outreach webinars. We've provided a lot of links for more information and contact information so that you could go directly to who you've heard from today and their teams to get more information. But I'd also like to point out the Early Childhood Connector. And I know the title is very confusing with this, which is very similar to what we're offering today. But the Early Childhood Connector is a little bit different. What it is a cross-agency early childhood connector newsletter and provider call. And our Child Care Center licensing unit, as well as our partners from throughout the licensing division, I actually sit as the representative for our licensing division on this cross-agency committee where we get together and again, pull together feedback we've heard from those that we've worked with out throughout the state to gather information of what we've heard, they're interested in learning more about. And then through the work we all do, we come together and we've created a quarterly newsletter and we're offering also quarterly provider calls. So in addition to today and all of those, again, ways that we've offered for you to reach out and learn more, there is this Early Childhood Connector newsletter and provider call. The newsletter is a subscription newsletter. So to get it on a quarterly basis or to read some of the archived editions that have come out, because we've been doing this now for about 1.5 years, where again, members from DHS, from the Department of Children, Youth and Families, Minnesota Department of Health, Minnesota Department of Education, and the Minnesota Children's Cabinet all get together and create this newsletter. So if you would like that newsletter, you can find out information. It's in your handout from today's session on how to subscribe to get the Early Childhood Connector. In addition, the next provider call and an opportunity for you if, say, for instance, you have a question that comes up after today, you could use this as another opportunity to ask questions of any one of us by submitting a question for the next provider call, which will be held on Tuesday, January 14th, 2025 at 7 p.m. So with that call, you'll be able to, there's information again on the link provided here and in your handout on how to ask a question and have it answered on that provider call. So we just wanted to share that information with you as another opportunity for you to hear from all of us in the state agencies that are working very hard to support the work that all of you do, as well as all of the children and families that we all serve. So we just wanted you to know that. And with that, that's all we have for today. We do have some extra time. I know there's some questions, so I think timing was good. I'm not sure if there's anybody that wants to jump in to answer any questions verbally. Otherwise, we will stay on and work at answering some of these questions in the chat as well. I'm going to ask my panel team, are there any that need to be answered verbally or are we good to go?
Lisa, what I realized is I'm not sure if when I was giving responses to individuals that people in the chat could see the question. So I just started adding question and answer together. I'll do my best here as someone else goes ahead and while y'all are still talking, I'll start to continue to do that.
And I will stay on. I will keep the webinar open so that you can answer those questions on the chat as well. And then we just want to note, again, kind of watch for this. We will, we've been doing our outreach webinars now twice a year. So the next one will likely be after the next legislative session. It's a nice timely time to offer it up again. And of course, there are multiple other ways that we as a child care licensing division and child care center unit work to communicate information with you. Our gov deliveries are very reserved for important information. And if you are an authorized agent of a child care program, you would automatically receive those. However, there's also a way to subscribe, and that is on our child care center licensing webpage, as well as all the multiple agencies that are out there working to support your industry also have updates that are sent out or information. And so I encourage you to look into the many agencies and sign up for their email updates as well. So with that, I think, again, we're going to say have a few minutes back. Hopefully you get a break in your day. Take a few more minutes to get up and stretch or ask that question in our chat because like I said, I'll keep it open. Other than that, thank you to all of our speakers and thank you all for taking the time to listen in. And we hope we've provided information for you that will be relevant and resources for you as they come up. So thank you. Have a great day.